Welcome to the triaging video for the UCI Irvine Flying Samaritans. We're going to go over just a few basics of triaging at our clinic in El Testorazo, Mexico. So triaging is the process of taking patient vitals and intake information. Do note that we use iPads to triage at our clinic. There'll be a separate training video for that, so you don't need to worry about it at the moment. And then we do require that all patients are triaged prior to seeing the provider, even if they're only there to see the dentist and even if they're only there to get a pharmacy refill. This means that you also want to do a full triage process when a patient wants to see the dentist, even if they aren't going to see the provider that day. Our dental providers still need to see a full triage in order to treat them. So the duties of triagers. Note the Spanish and English speakers. We're going to pair you up in pairs of two, so it'll be one Spanish speaker to one English speaker. So the English speaker, your responsibility is going to be to ask the written Spanish questions from the EMR. EMR stands for Electronic Medical Records, so our iPad. So you're going to want to ask the written Spanish questions from the iPad and type all the answers. Spanish speakers, your job is to translate the patient's Spanish so the English speaker can type along in the iPad. Please try to be as accurate and as complete as possible. A patient's reporting of their condition is subjective, so it is from their perspective. We want to use their language as best as we can and report the story as accurately and completely as possible from their perspective. Both the Spanish and the English speaking triage partners will take turns doing the vitals. So the vitals that we take at our clinic are the four main ones: blood pressure, pulse, respiration, and temperature. We'll also have another training video for blood pressure, so you don't need to worry about it now. It's a little bit more complicated than the other ones. So some other information that we do take at triage. Here's a list. A couple of things I wanted to point out. For medical history, make sure that you're asking every single patient their current medications they're on and recording it in this area. The provider is always going to need to know what meds they're taking. Chief complaint, this should only be maybe 1 to 5 words long. It's just going to be a quick statement, the reason why the patient is there. So like stomach pain, chest pain, constipation, something very brief, 1 to 5 words. History of present illness is where you're going to get a little more detailed and you're going to have more of a paragraph type summary. You'll want to include things like the context, when it began, related symptoms, how long they have been experiencing this illness, things of that nature. Review of systems, you'll also be responsible for taking that, but we'll go over that more in the iPad video. And then for females, you're going to want to take their last menstrual period, so you'll want to take the date, record if it was on time and if it was normal. Those are the things that your provider is going to want to know. So pulse and pulse oxygen, we take both these vitals at our clinic. Note that normal pulse oxygen is 95% or greater. So in this image here, this is actually what our pulse oximeter looks like at the clinic. 98 is going to be that pulse oxygen percentage, and then 73 is also going to be the pulse, or the beats per minute, or the heart rate. It can be referred to by all of those things. And so a normal pulse is going to be 60 to 100 beats per minute. This is the actual temperature probe that we use at the clinic. So in order to power this on, you're going to want to push that circle button with the line through it, and that's going to power it on. It's going to have the temperature from the previous reading, so you're going to want to push the power button again to clear that reading. And then once you've wiped the end of the probe with an alcohol swab and dried it off, let it air dry, then you're going to want to hold the probe up against the patient's forehead for about 5 seconds. It'll beep after 5 seconds, and go ahead and record the temperature. Note that normal human body temperature is approximately 98.6 degrees Fahrenheit. Respiration, there's many different ways that we used to do this in the past, so this is the way that we're currently going to do it. We want you to pretend to take their pulse. The reason for this is you've already taken their pulse when you use the pulse oximeter. So if you pretend to take somebody's pulse, you can use your peripheral vision to count their breaths instead. The reason why we want you to do this is because if you tell a patient you're going to start counting their breaths and take their respiratory rate, you're gonna get very inaccurate readings because people they'll get conscious about their breathing. So have your triaging partner time you, and after 20 seconds, go ahead and stop your count. And the triaging partner will call out when the time is up. Multiply whatever value you counted by 3, and then you'll want to record that value in the patient's chart. That will be the respiration, or breaths per minute. So then the average breaths per minute is usually going to be about 12 to 20. And that can vary with age and health and many other factors, but that's the approximate range to keep in mind. Vision, we give out prescription sunglasses. We also give out UPA UV protection sunglasses. So we do take vision at our clinic. Make sure you ask a patient if they want to have this taken first. They may decline because they may have already had it in the past. A lot of our patients come every month. So if you are going to take a patient's vision and they do agree to it, you'll want to stand them 20 feet away from our vision charts. There's a duct tape line on the floor at the clinic. You want to have them cover one eye and then read on the chart, and then cover the other eye and read on the chart so that you're getting vision from both eyes. These are what our charts look like. This is the letter chart. So in order to determine if they're 20/20 or if they're better or worse, you want them to be able to read between the green and the red line, and that's approximately 20/20 vision from 20 feet away. If they can't read below the green line, so they can only read above the green line, then their vision's worse than 20/20. If they can read below the red line, then they have better than 20/20 vision. And these are the things you'll be responsible for marking in the chart. So also, do note the literacy rate is lower in Mexico, so you may need to use this chart here instead. So you'll want the patient to indicate direction, up, down, left, or right, that the E is pointing. And they can just tell you the direction, and you'll repeat the process exactly the same as you would as if it were the letter chart. Height and weight, we take that at the clinic as well. You'll want them to take off their shoes before you weigh them, and also because while they're on the scale, you're going to use the scale to mark their height, which we'll go over more at the clinic. And if they're a diabetes program patient, then you'll want to ask them if they want to get their labs taken. This includes blood glucose, among other things. Or if they just want to be tested for diabetes, that may be the case as well. You'll want to ask for more of our middle-aged patients. So if they do want to get their labs taken, then you'll want to take them to the diabetes area. And they'll get that done. And once they've either declined that option or they've completed the diabetes labs, then you'll want to take your patient to the waiting room and wait until provider is available. Make sure you and your triaging partner are waiting with them the entire time, so they don't wander off, and also so the same iPad stays with the same patient the entire time. When the provider is ready to see them, take them to see the provider. You'll want to note here the translating triage partner is generally the Spanish-speaking one is usually the one who will translate for the provider, but in either case, both the English and the Spanish-speaking triage buddy need to obtain patient permission to stay while the patient gets treated. Even if you've been back with that patient before while they've seen a provider, even if it seems like you guys are on good terms, you need to ask every single time you're about to go back when they get treated by a provider. So after they're done being treated by the provider, you'll want to take your patient to the pharmacy to get their prescription filled. You do need to stay with them until their meds actually get dispensed, because the pharmacy needs your iPad to see what it is that they've been assigned for a prescription, as well as your Spanish-speaking triage buddy to translate while they dispense the medication. This step may vary a little bit if we have a dental provider and your patient wants to be seen by the dental provider. We may have you take them before pharmacy. But these kind of variations we'll discuss at the clinic if we do actually have a dental provider. So after they're done getting their meds at the pharmacy, congratulations, you've triaged your patient, and we repeat this process all over again.